Hello, everyone. Hello, Dr. David. Welcome to our Immunity Group Australia conversation. Now, we are joined by yourself, Dr. David Mass from the UK. You are a general practitioner who was very brave to be one of the pioneers in your practice to introduce oral immunotherapy. Now, one of the most interesting developments in Australia right now, actually, is general practitioners developing subspecialty in allergy education and starting to offer initially sublingual therapy, but slowly also OIT. Now, I wanted to ask you to maybe present yourself to our audiences. How did you become a doctor interested in this particular space? And where did you find the bravery from? What is your source of bravery in this space?
That's very kind of you. It's very nice to see you. Thank you for doing this podcast. I can have lots of fun. Um, in my opinion, life happens. I went to medical school. My choice of going there was because it was far away from my parents, but close enough to have my washing done. So I'm very family based guy. I kind of stumbled into it as you do after school here. You don't really take time off before medical school. And I kind of, in a way of kind of drifting through, I kind of managed to float into passing all my exams and then thinking, oh, how am I going to get back to London, which wasn't very far away. And essentially, I found myself in a medical rotation in Guys and Tommies, which, if you look back, is like this is the thing to strive for. And I was doing A&E for the second time, and basically, I thought, oh, I don't really like hospitals. And then Adam Fox came along, and he gave a lecture in our A&E department, all about anaphylaxis. And his opening gambit was something like, in Finland, there are about 50 allergists and 7 million people. And in the UK, there's 50 allergists and about 70 million people. And I'm like, unmet need. At a similar time, just recently getting married, I had our first kid who turned out to have a delayed cow's milk protein allergy. And really, no one knew very much about what was going on at all. So I thought, that's interesting too, kind of making life choices. So decided, right, hospitals are not for me, GPs for me. And you know what? At the same time, I think allergy is pretty cool. And at the time, there was only one or two universities that were doing a diploma in allergy or a master's in allergy. So I went on the Southampton course, which was distance learning, which if you have like an under 2 year old, having like a 3 monthly 2 day break was amazing. And managed to go through the course, learn loads about allergy, and ended up being a GP, and at the same time having a qualification in allergy. And then that was kind of where it started. That was about 15, 20 years ago. And as part of that training, you needed to do clinical training. And so I just kind of emailed Adam and I'm like, hello, do you remember me? You gave me this talk ages ago. And he's like, oh, yeah, sure. So come and sit in. And since then, I've been working with him at least 3 or 4 days a week. Initially
Wow.
starting with a patient a week, and now moving up to pretty much full time. But I'm very much a GP at heart, so I still work in the same NHS practice, being a jobbing GP, very much aware of my role as, cradle to grave, really committed to my patients. But kind of, and throughout that time, I've been like a partner and appraiser and a trainer, done the real deal. But actually, what I've noticed for that is at different points in your life, you have more interest in things that you do and the things that you work. And at this point, it kind of it's become more and more and more allergy as the need is there.
When we met in
That's
Dallas last year at the Fast Food Allergy Support Team Congress, there were so many allergists in the room, but there was a great number of UK health professionals, including yourself. I call it the British delegation in Dallas. And
yeah.
this year apparently it was also very successful and replicated. So, what's your impression of this particular congress specializing in OIT and sleep vis-a-vis any other allergy congress that you have attended? Sort of any reflections from this year's meeting?
I think fast is amazing. To be honest, the way that conferences work are quite variable, and there are different drivers behind various conferences. And what I liked about the FAST conference is I actually took away different things. I've been to two of them. Um, is that it's very evidence based. We're trying to create an evidence base for an area which isn't particularly well funded, but everybody there is seeing that this is making people's lives better and improving people's health. And I think all the various doctors, whether you're a GP, whether you're a specialist, whether you are, part of the multidisciplinary team or you're a specialist nurse, are looking for somewhere to say, I'm attached to a larger evidence base, and are my choices the right thing to do? Which I think is amazing. So actually, I was thinking about this because I knew you were going to ask me a little bit about the FAST conference. I actually took different things from different times, which I thought was quite interesting. Because when you get there, you actually see that there's a big plethora, there's a range of people who are like, I might try this, to people who go back every year and are, treating thousands of patients. And my takeaway message from the first was, I mean, we'd already treated over 500 people, was, is my selection process okay? Is my consent in line with everything else is doing? And actually, we found yes, it was. I think what we were doing, and they do a survey in advance, which was great to get everybody's kind of actual activity, and we were in line with what we were doing, which was great. And then you kind of go away for a year, and you kind of do more work, and you develop a little bit. And actually, I half-assed, should I go back next year? What am I going to learn? And actually, I learned it, I actually saw it from a completely different perspective. So this year, for me, it was more about making the right choices for that patient at that point in their life. And actually, similarly as my GP journey has been a journey, and you're doing different things at different times, providing OIT for a 4-year-old, knowing what tools you have for, say, a 17-year-old, knowing what changes are going to have when they're actually now going to be a 20-year-old or an adult. I think I find quite interesting, because it's an area of development for the UK, which kind of we're at the centre of, and also for allergy patients. I think it's great.
What I found really interesting after this year's Congress is the announcement that there will be a Fast Europe meeting. Can you tell us a little bit about that? Because quite a few Australians would love to have a holiday in London next April.
Well, you know what? Looking forward to it. It is in April. It is fast. It is where I work. It is at the Allergy. It's being hosted by the Allergy Centre of Excellence, which is all the big professors in the field: Professor Fox, George Dutoit, Gideon Lack. Everyone gets excited. And also James, James, like the big cheese when it comes to kind of the clinical nurse specialists and advocate for the whole team. And hopefully we're just going to bring the speciality to Europe, because I think it's a matter of aligning this treatment for Europe. People were coming from Europe to here, and yeah, going to Dallas is a long way to be able to share information. And we are a centre of excellence. Research is at the centre of what we do. Education is at the centre of what we do. We're in a lovely shiny building. We are offering great care, and actually, we're just mimicking what happens in a tertiary, even quaternary service, whereby you have an obligation to develop, grow, and share that information and disseminate it, so that people can apply locally in a safe way, so that we can apply our treatment in a safe way.
Has there been much interest from other general practitioners in the UK, but also in Ireland perhaps, to develop further knowledge in this space?
Has there been? Well, with my BSACI hat, do you know what the BCS is? British Association for Allergies and Immunotherapy. There are very much interest, but I think it's like in the UK, we have the NHS and we have private world, and there are different barriers to kind of being able to provide things. But definitely, it's taking off. They're starting with specific allergens. I think palforzia, was exciting when people thought, oh, this is a medicine that we're doing, and people could legitimize and get their head around that. But
Peanut in a
actually,
capsule?
essentially,
Overpriced peanut in a capsule.
I think I don't know, I guess what was good. I think people felt that there was like evidence behind what people are up to. This is how people like to know. This is how I do it. This is what is required. Now, obviously, palforzia is not around anymore quite so much in the UK, but it has kind of laid the foundations that this is a treatment that works. And I think people understand that, and also patients understanding that what, I can go out and have a peanut and a half accidentally, and it's not be a problem. This is going to make my life better, and then being able to extrapolate from that. I think there's lots of lessons to learn, I think. So I think that's legitimized people's interest definitely in the. So here we also have secondary tertiary secondary hospitals, that sort of thing. So it's being able to provide the care for people that want it locally, I think is quite important. And yeah, there is interest, definitely. And if we can support that'd be great.
What I love about the place where you work and the UK generally is this openness and communication with media organizations. In Australia, when anaphylaxis happens, it is very much sidelined. There could be one perhaps or two newspaper articles, and then leave it to the coroner. So 2 3 years later maybe there'll be another newspaper article. In the UK it seems to be the opposite. There are so many organizations which are working together and working with doctors like yourselves, which is incredible. And I think there are a lot of lessons to be learned from that example. There is also a lot of writing now about food allergies. If you go to, I don't know, Amazon Australia, every few weeks there is a book popping up, another one on food allergies. A very good thing is that medical professionals are more involved in that writing space. How do you as a practitioner deal with all that abundance suddenly of both interest and food allergy literature in every sense?
I think that's a wider question. How, what literature is noise? What literature is evidence-based?
Yeah.
How does it influence what you do? Um, to be honest, I'm a puns and dens guy. So when I come across an unmet need, I then go and seek out how to answer that question. I'm less from the kind of, oh, only due to busyness, being able to say, oh, there's a new book, I must see whether that's right or wrong, or praising that sort of thing. I'd be interested to know what, I mean, again, also it's where the literature is aimed, if that makes sense. So, I think me reading a book about how to feed my newborn isn't of particular interest right now, if that makes sense. But having said that, I think there are a few coming around the corner, which is embracing the early allergen kind of
New
feeding
guidelines.
new guidelines, which is exciting. And to be honest, books are great. They look great they look great on the shelf. To be honest, I don't know. I've always felt that. Actually, I need to say, I once met a very, very impressive guy who set up a foundation. He made a lot of money elsewhere, and he set up a foundation helping science with his money. And he sat there in a little office in a very modest place up in North London, and I went to go and meet him. And he had literally millions to dish out to scientists who he felt needed to grow or develop or have an idea. And something he told me is that basically, if your idea can't be expressed on an A4 piece of paper, so for example, if the message of your book cannot be expressed on a good summary, then it's probably got a little bit too, it needs assessing before you even start. So I often find that the books are great, and recipe ideas make sense. If you need a book, you need that sort of thing. But often I think signposting people to the message that's important. If you can't get it on one page or in a clear thing, then it's kind of like, maybe that's not where I need to be going right now. But looking down at the kind of the references and approaching those sorts of things, and validating where that sort of stuff comes from, and thinking, why is that message there? That's quite exciting for me. So I approach it more that way. So I'm less of a book guy and more of a kind of, reviewing individual articles that make sense to me.
When it comes to your personal experience with practice, what do you think are some of the main challenges for, let's say, a new doctor, whether it's an allergist or a GP, wishing to pursue oral immunotherapy? Do you think there are more physical barriers, or in terms of the space and the staff and scheduling, or do you think there are other sort of things they should consider before embarking on such a sort of new journey for them?
Great question. Um, I think the barriers to entry for providing OIT depends on where you're starting from in the first place. So you're going to have personal factors, kind of, do you have the knowledge, understanding, why you're getting into this in the first place? That varies from different places. So for example, I notice in this fast, they do spend a fair bit of time developing your business sort of thing. Whereas the UK is a little bit less like that, if that makes sense. Then
Developing
you've
your
got,
knowledge first. Yeah.
yeah. Um, so yeah, actually access to knowledge, having an understanding that it's even there in the first place and the impact it can have on people. The UK is very NHS based, which is brilliant. But if you think about how it was set up in the first place, it was basically set up after the war to provide basic care for people. So if you've got cancer, you might get a bit of chemo. We want to make sure your baby is delivered and doesn't die under the age of 5. We want to make sure if you've got a bad knee, it gets replaced. Now, obviously, since 1948 and now, that has completely morphed into something different, and everybody's competing for the pot of money to be able to do what you're doing. And therefore, you've got a workforce which is stretched before you start. And OIT there's this. I actually don't think setting up takes an enormous amount of time, but it does in terms of being able to find the right people in the right place. But actually being able to put together a business case to whoever you're working for to say, this is great, I think it seemed like an enormous barrier. And if anything, if there was some sort of support to help people go, this is what we need to do, that starts from the top. So Adam's involved in the National Allergy Strategy Campaign, being able to, demonstrate that this is something that is important would be a good place to start. But to be honest, at the moment, we're still at a point where we're saying, schools, please can you have EpiPens? Please be aware that you need to just do the basics right. So, if we're in the process of creating a cake right now, we're trying to get the cake right. And the OIT is a little bit like the icing, but I do think with time, we'll have a well-decorated cake.
I love that. I think that's absolutely brilliant. In Australia, not every state legislates that teachers have a compulsory training for anaphylaxis. In some states, it's actually optional. Of course, they say it's the funding issue. Luckily, in New South Wales, where I'm based, it is compulsory, but not in Western Australia, for example. Especially private schools vary in their policies, but also for public schools, if there was a donor or philanthropist to fund it, surely they would do it. So I think we're in a very similar sort of situation in Australia, where teachers haven't got the training, let alone further than that.
Do you guys have Neffy yet?
Yes, it came out this month on PBS on the pharmaceutical benefit scheme. It's not easy, not every pharmacist knows how to order it, actually, from my own experience. I even talked to the supplier and they said, no, no, it's a new, even if it doesn't show in the stock list, the actual pharmacist needs to phone the supplier and place a special order. But being on PBS means Australians will now pay $25 approximately for 2 Neffys. That's like £10 instead of $200.
Yeah. So here it's on the formulary, but they haven't figured out how they're going to pay for it yet. So the way we're doing it is we provide it privately, knowing that it's going to last 2 years, with the hope that the next one that they're going to get, it will be on the NHS. So
It's
and
a
also the
positive option to have, I think. A lot of patients who are hesitant, or a lot of families who are hesitant to use a needle, I've heard especially fathers prefer this new way of administering. I mean, I think in Australia, once it comes to sublingual, which is in the production, somewhere in the world, I think that's the one which probably will have the most uptake in Australia by the parents in particular.
compared to 20 years ago, there are loads of things that are changing and moving really fast. And that's brilliant. If you think about, you needed to use your omalizumab, I will not be surprised if there's a clever alternative around the corner, like an oral medication. Like I do keep an eye out for these sorts of things. And that in combination with things like OIT nice and early, with a view to getting to a point of free eating where you don't need all those sorts of things, and knowing what choices are in your armory. So it's interesting. So when I was at Fast, what I did, I mean, if I not a criticism, but it's very much focused on what's available and now. I did get a sense that sometimes what's in the future stuff wasn't there. And again, that's mainly because it's driven by various drug companies, and that's not the place for that, if that makes sense, to kind of, do you know what I mean? We don't need to know, oh, look, we've got this wizardy thing around the corner, because everyone will switch off and it will take away from the actual message of why you're at that particular conference.
Which I've noticed at this year's as well as last year's FAST OIT, the psychosocial aspect of both OIT and food allergy parenting. Do you think that's a valuable resource or something that would be valuable for your patients to have a psychologist's involvement of some kind?
Again, we're really, really lucky where we are. We've got psychologists, we've got specialist dietitians. But again, sharing that information is really, really important. Um, Unpicking years worth of food aversions and addressing people's relationships with food in context with OIT or even before OIT or even if they don't do OIT is super duper important because people's quality of life is terrible. They're like petrified to leave the house. They're petrified to go and eat something anywhere. Even as basic as what does, may contain labels mean, being able to interpret the basics, having a realistic understanding of risk. It almost goes back to there are loads of literature out there when you are bombarded with information all over the place and your problem, which your algorithm will tell you, is enhanced a million times, it's terrifying. Like, none of us can control how we use our scrolling and our doom scrolling anyway. Can you imagine if you're being told just about your problem the whole time, and then being able to unpick that? I think is really important. The psychologists are in a great place to do that. And there's loads of good work being done. But again, are the right people being able to have access to that, it's just a grossly underfunded area. And again, if there are booklets and online workshops that can help, and the team here at ASAR are hoping to address all that sort of stuff.
Well, I would like to congratulate your team for leading the way in the UK and Europe, certainly in this space. And I hope that Australian doctors, nurses, psychologists, dietitians can also collaborate in the future with the colleagues from your center and all around the UK, because the UK really is, I believe, the leader in this space now in Europe, without any doubt, despite all the shortcomings.
I think maybe interesting. I think it's a good place to start. I mean, it's a seed of something better. To be honest, it's a sort of thing that you could kind of disseminate online as an excellent service. Like you could be seeing a psychologist from the UK in Australia online if that
Absolutely.
was done. To be honest, I think it's just the number of people who are trained in that. I mean, what one of the interesting things is it in the kind of tertiary center setting, often people have been referred by their secondary care to their local psychologists. But one of the problems that they have is that they are not specialists in allergy world. So yes, I appreciate how you feel when we get emails, just like they are really nervous about being allergic to stuff. Do they need to be? So it's kind of having that skill set. So maybe increasing the having a more targeted training for psychology and allergy together would be important.
Absolutely. And in terms of also patient education, that's something that we never have enough of, especially to counter, misinformation. There are so many influencers claiming, you can just avoid three things and your allergies will be miraculously gone by the next day. I mean, that's quite dangerous right now in the kind of social media space we're living in.
I actually have to say that I spend probably 40-50% of my time kind of unpicking people's health beliefs related to not treating steroid avoidance, you know, again, going back to the basics, what they've kind of learned along the way. And often just listening as to where their thoughts have come from and kind of going back to the basics of when people do understand a risk of something, actually re-establishing what the benefit of something is. So, your kid's not now going to sleep, for example, if you treat their eczema, they're going to grow, they're going to be less itchy, they're going to be less like, open to catching, developing allergies, that sort of stuff. Then weighing it up with actually expressing in kind of relatively understandable terms a risk of something usually works a little bit, but actually just having the time to be able to listen as to where that's all coming from. Because if you don't listen to it, then people just feel, poo-pooed, or they feel kind of that their concerns aren't being listened to. And actually, that what you bring to the table as a GP is consultation style, ideas, concerns, and expectations. It's not just about my allergy here, it's about what I'm concerned about, just as much as and having years of experience of getting to that in 10 minutes in a general practitioner's office compared to 45-minute luxury of an allergy consultation is a useful tool.
Absolutely. In Australia, allergists they have very, very long waiting lines, and pretty much general practitioners, like in the UK, are the first ones to see food allergy patients. Actually, usually if you get discharged from the emergency department, the next day you would go to your local GP because it takes 6 to 8 months to get privately to see an allergist. And publicly, it could be between 3 and 5 years unless you see the allergist privately and then somehow then putting you into the public system.
It's yeah. I've heard there is some innovation in Australia with the peanuts. They're doing early
For
introduction.
babies, only for
Yeah,
babies, only for babies, which is a step forward than before for sure. But what about 25-year-olds, 30-year-olds, 18-year-olds, 19-year-olds?
yeah, yeah, absolutely. Being able to address that later in the day, having access to healthcare is important.
Yes, and we find that adults who complete OIT actually are quite compliant because they remember all the reactions. They remember living with that burden, with bullying, with isolation, social isolation, and on all the rest. Whereas usually parents of teenagers can report sometimes that power struggle. Have you taken your dose today? Mom, don't tell me what to do. So, do you find the same in your practice that there are some age groups which are more challenging because of that developmental behavioral sort of change?
Definitely. And definitely. And again, with the benefit of having my own 18, 17, and 13-year-old and remembering them when they were three, it changes and that's okay. They're growing from being children to adults. And so, for example, I don't know if I mentioned, you said, one of the things I'm developing at the moment is more of a transition clinic from child to adult. Because just having the awareness is you do need to kind of treat them like little adults and big children and know how to kind of navigate through that. Does that affect OIT? Definitely. The ones that don't do well, A, are the ones who never had buy-in in the first place. The parents see the thing, they think this is going to be the fix for my child, but that's because they never really included the child in choice making at the beginning. And actually, that conversation is so important because you can just go down a different route. You can decide, okay, now's not the time. You can do SLIT when you're older, or maybe if this is getting in the way of what you're doing right now, your relationship between your parents is more important than that issue. And or okay, well, again, maybe also listening why they don't want to. I don't want to because I'm being okay. I'm not going to change that stage in your life right now. But we need to think about this. Or the other way, like maybe the parent needs support going, okay, we need to support you to be able to express what you're trying to say with various sessions. Actually, what we sometimes do is introduce patients who've been through this to other patients who are slightly older or similar kind of background so that they can have a chat with another teenager, go, oh, there's nothing to worry about. Because sometimes these teenagers are just scared and they don't want to do it because they're scared. And when they notice that actually it will be fine, or that they're in safe hands, and they've been communicated in a way that works with them. That's really important.
That's very well explained. Trust is so important from both sides. Trust in the parent administering OIT that they will be doing the right thing, and also trust in the service provider that you will get the best education and advice. Sir David, for being with us today and for sharing your valuable insights. And let's speak again, perhaps after next FAST OIT Congress in Europe.
Yeah, I think that would be great. It's really nice to see you, and keep doing what you do in Australia. It's really important.
Thank you so much.